Hello, Mr. Corona.
Hi.
My
You
name's
can call me Lamarcus.
Lamarcus. My name is Mark, and I'm a student physical therapist, and I'll be working with you today.
Okay.
So I'm going to be asking you a few questions to get to know a little bit more about what happened.
Okay.
And have you ever been to PT before?
I have whenever I was 10.
Okay. And so you have a general idea of how everything goes.
Little general idea of it.
Okay. So what we're going to be doing today is we're going to have a 15-minute test.
Okay.
Or exam to give me a better picture of what's happening.
Okay.
And so I just want to say thank you for choosing our clinic and placing your trust in us.
Yeah.
So Mr. Lamarcus.
Yeah.
How old are you?
I'm 19.
19.
Mm-hmm.
Okay. And what do you do for a living? What is your job?
I'm a part-time worker at Fiesta, Texas.
Fiesta, Texas.
And then I sell snow cones there, and then I'm also a student at the community college here as well.
Okay. Fiesta, Texas, as in Six Flags.
Yeah, Six Flags.
Okay. So what's your favorite ride over?
I really like Mr. Freeze. I'm a big fan of Mr. Freeze.
I'm more of a Batman fan myself.
That's a good one too. I like that one too.
Mm-hmm. And also for your school, community college, university?
Yes, I eventually want to transfer to, I'm at community college now, but I eventually want to go to a university to study fashion design.
Okay. And for your work, can you tell me a little bit about what do you do on a daily basis? What does it entail?
I generally push a cart around, sell snow cones. I bet I probably walk, it's a lot of walking, probably about 2 miles during a given shift.
2 miles?
Quite a bit.
Okay. And what about your school? Is it a big campus that you have to walk around?
It's not super big, but I bet I walk a mile for school.
Okay. About a mile?
About a mile for school, so about 3 miles a day.
Okay. And then also, do you have any exercise routines that you want to tell me about or any hobbies?
I guess it can kind of count for exercise. I like to dance, and that's really my only main hobby. I don't really do anything outside of school, work, and dance.
Okay.
So.
Can you describe like what kind of dancing?
Two-stepping.
Two-step?
Really enjoy two-stepping.
Okay. And you say it's a exercise and a hobby of yours at the same time.
Yeah, it gets me sweating, so I consider it probably a good cardiovascular exercise.
Okay. So I see that your doctor referred you for your ankle.
Yes,
my ankle. I'm just going to ask you a few questions about it to get an understanding of what happened.
Yeah.
Okay. So can you show me where you're experiencing symptoms?
Right out here on this left ankle, really doesn't go into the foot at all. It's just right there on that left ankle.
Mm-hmm. And what about on the other side of the ankle?
Not at all.
There?
Not at all.
What about your foot? Anything on the top or the bottom?
On the foot.
Okay. What about going up the calf area?
Nothing.
The front area of this?
No.
What about here?
No, not at all.
And the back of the leg? Going into the hip?
Nope.
Okay. Just making sure.
Yeah.
And then what about the right side? Are you feeling anything there?
Nothing at all on the right side.
Okay.
Perfectly fine.
Can you describe what you're feeling? Is it a sharp pain? Is it a dull?
Dull's a good word for it. Dull and achy, probably.
Achy?
Mm-hmm. I'd say is probably a good word.
Okay. And also along this dull pain, can you give me numbers 0 to 10? 0 being nothing at all, and 10 being the worst pain you've ever felt.
Okay.
What is your pain right now just sitting in front of you?
Sitting here about a 1.
Okay, about a 1.
Yeah.
And then what about when it gets to its worst point?
Oh, it gets bad, about an 8.
An 8?
About an 8.
Okay. And when it's at its best point, what do you feel?
Nothing also.
Nothing at all? 0 to 10?
Yeah, 0 out of 10.
And lastly about this, do you have any numbness or tingling in that area?
No, none at all. None just tingling.
So I took some notes of what you described to me.
Okay.
And then this is what I have about this area. Does that confirm?
Yes, that's that area. That's right.
Okay. So next I'm going to ask you about, do you have any other symptoms that you're experiencing right now that you want me to know about?
No. I'm good.
So just the ankle?
Yeah, just the ankle.
Okay.
Ankle's enough, though. It's pretty bad.
Okay, so when you do get to an 8 out of 10, can you tell me what are you doing to get to that point? Activities?
Walking. Going up or downstairs, both are painful. Putting weight through it makes it pretty bad. I'd say those things are what aggravate it the most.
And then when you're walking or climbing stairs, you said?
Yes.
Can you say how long can you walk or how many stairs you can climb before it starts hurting?
Maybe like 100 feet.
100 feet? Okay.
With full weight bearing through that foot, putting all my weight through it makes it pretty bad. And then for stairs, I'd say 5 or 6 on the way up, and probably about 5 or 6 on the way down too.
Okay. And when it does get pretty bad, how long does it take to go away?
It takes about 10 to 15 minutes of me like icing it or elevating it or just getting off it completely.
Okay. So you said you ice or elevate it.
Yes.
Is there anything else that you do to make it the pain go from an 8 to?
I've been putting in some Epsom salts. I don't really think that helps. Some my mom suggested, but I don't really think it helps.
Okay. And how long? When you said around 10 to 15 minutes from icing, raising foot.
Yeah. It'll take about 10 to 15 minutes.
Okay, so for the icing and the raising your foot, do you feel that that's really helpful? Do you feel like it's actually helping?
I think the icing and the elevating really does.
Okay.
But yeah, I think those are the only two things that really help.
Okay. So we're moving on a little bit. Can you describe how you feel in the morning? Is it stiff? Is it painful?
Stiff, for sure. It's definitely stiff.
Okay. And when it is stiff, does it go away after a while, something like that, or does it stay throughout the day?
10 minutes.
10
minutes or so once I start moving it.
Okay.
And then the pain starts coming on after that.
Okay. And throughout the day, does it get better or worse?
Worse for sure.
Okay. Worse. Just from the walking around?
Yeah, just from the walking around. If I stay off it the whole day, it just stays about baseline, but it doesn't get any better.
Okay. And at night, I noticed on your forum you said you have some difficulty sleeping. Can you tell me more about that?
Yeah, if I get into like the wrong position, if I like bend it too much or something, it starts to hurt during the night, and it'll wake me up. Generally, I've started taking like what's it called? Motrin
Yes.
before I go to bed, and that helps a little bit. Helps me sleep through the night, but yeah, it's not like I don't stay up all night or anything.
Okay.
It'll just wake me up occasionally.
Okay. And a little bit about your living situation. You said that you had to go up and downstairs. Can you tell me like what kind of house you live in?
2-story house. My bedroom's on the second floor. Actually, all the bedrooms are on the second floor.
Second floor, okay.
Yeah, and so I have to climb the stairs to go to bed unless I'm going to sleep on the couch, which isn't super comfortable either. But so I have to go up and down the stairs.
Okay. And do you live with anyone?
Yeah, my mom and my grandma. Still live with my mom and grandma.
Okay. There's nothing wrong with that.
Yeah, I just kind of want to move out on my own. I'm reached that point. Kind of want to get out on my own.
Okay, understand. And also, do you use any assistive devices, something like a crutch or a walker to help you get around because of the pain?
Neither of those, but my grandma's got me wearing this immobilizer boot. I think it's pretty stupid, but it shuts her up, and she quits complaining about my injury and kind of leaves me alone, so I do it.
Okay, so how do you, with this immobilizer boot, how do you feel it works for you? Do you think it's helping?
I don't think it works.
You don't think it works?
No, not at all.
Okay. So moving on, before we go further into your ankle, I want to ask you some general questions. I see in your forum you marked no for any history of family disease or disease with you currently. Is that's
correct? Yeah.
Okay. And I also see that you marked yourself as a smoker and you have some alcoholic beverages. Can you tell me a little bit more about how much?
Maybe 2 to 3 packs a week.
Smoking.
Smoking, and then maybe 3 drinks a week.
Okay.
Generally, those are kind of in conjunction with my dancing.
Okay. So mostly on the weekends.
Mostly on the weekends, yeah.
Okay. So I also see that you marked yes to feeling a little bit down, depressed. Can you tell me a little bit more about that?
That's mainly just because of the ankle. I'm not able to go out with my friends anymore. It looks disgusting since I've got to wear that dang immobilizer boot that my grandma's convinced will work. But it just looks gross. I can't really do anything. I'm not able to be social anymore. So I miss my friends. I miss looking normal. But
so that is something that we can help with. We could help strengthen the area.
Okay.
That is what happens sometimes when you don't move a
Okay.
certain part of your body for a while. It could appear like this.
Okay.
So it is something that I can help.
So
you
it's
with.
it's fixable.
It's fixable.
Good deal.
Okay. So have you had any surgery, something like that?
No surgeries.
Okay. And have you had? You said you've seen PT before.
Yeah, I went whenever I was 10 years old for my knee.
Okay. And how do you feel that helped you? Do you feel it was beneficial or?
I don't know. It was super painful. So I was kind of apprehensive coming back in here for therapy again whenever the doctor suggested it, just because it was so painful. That's why I'm a little nervous about it.
Okay. Okay. And can you one last thing about that knee? Can you tell me what happened to it?
I was running down a slip and slide.
Oh, okay.
Not the smartest of decisions, and I dislocated my patella.
Okay,
so it was pretty traumatic. Yeah.
Okay. Okay. So
I think it's a patella. Whatever the thing that's on the front of the knee. Yeah, it's dislocated. Yeah.
And then I'm going to go back to your ankle now.
Okay.
Can you tell me a little bit about how you hurt your ankle?
So I kind of a crazy story. I was racing the golf carts around Six Flags with my coworker, kind of NASCAR style, just doing laps. Rolled the golf cart over, took a turn too sharply, and rolled my ankle up underneath it.
Oh, okay.
Felt immediate pain. It's been bad since they've been swollen and everything. So it was, yeah.
Okay. And can you tell me what you felt? You said immediate pain. Was it like a sharp?
It was a sharp pain at first. So I thought I broke something, but the doctor said I didn't break anything. So. I don't really know what it is, but I thought I'd broken something.
And do you feel that can you tell me some ideas that you think would happen to your ankle?
Besides that break, I actually know I feel like it twisted in such a way that wasn't normal. So it's gotta be something like the muscles or those other things down there. You have a degree, you know what I'm talking about.
Yeah, just trying to get a better picture.
Yeah.
And have you ever hurt this ankle before?
No, I've not.
Okay. And you mentioned something about seeing your doctor.
Yeah.
Can you tell me a little bit about what they told you? Did they do any tests on you?
Yeah, I saw him about a week ago, 2 weeks ago. He took some imaging. That's how I know it's not a break. I think he took a MR, X-ray thing.
And do you recall what he said about the X-ray?
He said there wasn't a break and that it was negative. Negative.
Okay. And did he give you any medication for your pain?
No. I told him that I was taking the Motrin stuff, and he said that was good to keep taking as long as I wasn't taking too much.
Okay, so nothing prescribed, just recommended.
Nothing prescribed.
Okay. So I have a better picture.
Okay.
Can you tell me a little bit about a typical day before you hurt your ankle?
Generally, I get up, go to class, go to work, come home and study, go to bed. Do that 3 miles of walking, and then on the weekends is whenever I go dancing, so I can dance on Friday and Saturday nights.
Okay. And does your ankle injury affect any work?
I can't work right now. I still go to classes, but it's significantly harder to walk to and from class. Can't go dancing on the weekends, like I mentioned. Can't really go hang out with friends or anything, which kind of sucks. But yeah.
So you haven't been able to go to work at all, or are they allowing you to work?
They've given me a different job, just where I am more stationary, so I'm not pushing the cart around right now. But I'd like to get back to doing that. I love socializing with the people there.
Okay, so thank you for telling me that.
Okay.
We're almost done. I just want to get some more pictures of what you're experiencing. So what are your expectations of physical therapy?
I just want to get back to how things were. I want to be able to dance again, hang out with my friends. I want to be able to work, walk around the park. Want to be able to walk to class normally, be able to go up and down stairs without having to think about how difficult it's going to be.
And what do you think you can do to get better, recover quickly?
I think probably some of those strengthening exercises will help. Maybe some ice since it's so swollen. I don't know what we're going to do about the skin condition, but I'm sure you've got some ideas.
Sure. I'm just thinking about some right now.
Yeah, awesome.
But and when you want me to teach you exercises, how do you learn best? Do you learn best by me showing you, me explaining it to you?
Generally, it's showing and then continuing the explanation through it. So just some feedback while I'm doing it on what I'm doing right or wrong, and having me fix it during the motion.
And so, and also, I noticed that you seemed a bit nervous during this.
I am.
Can you tell me a little bit about what you're thinking right now?
Yeah, just since the prior time was so painful and everything, I'm nervous and apprehensive. I'm kind of anxious because I want to get back to hang out with friends and everything, but mainly because it was so painful the first time.
And besides the pain, do you have any other fears or concerns with physical therapy?
No, just that it won't get better, that it'll continue to look like this and be gross.
So I've seen some cases similar to this before, and I can assure you that with some work, it does get better, and you should be able to go back to what your normal lifestyle.
Okay.
And also, my job is to help you get better, and I want you to voice your concerns with me. So if there's any, you said there is a past experience of physical therapy is painful.
Yeah.
I want you to let me know that if a treatment I'm doing is too painful or you're not comfortable with it, because this is for you. We want you to get better. And if you're experiencing pain or you are unable to complete the exercise, it might not help you as much as it should.
Okay, I can do that.
And do you have any questions?
No, I'm good. Thank you.
Okay. So we're going to move on to the physical exam next. It's about 45 minutes. Is that fine with you?
Yeah, sounds good.
Okay. Thank you for your help and information. We're going to move on now.
Okay.
Thank you.